How many different diagnoses do dermatologists see in a day? I've got my mobile clinic down by the Idaho State Capitol once again. The last time we did this, we saw so many patients. It was our busiest mobile clinic ever. So today, you're gonna see two counters on the screen. As we see our patients, you're gonna see how many different diagnoses that we see. I'm gonna tell you a really short amount about each of them. And then you're also gonna get another count of how many potential skin cancers or precancerous lesions we identify. It's gonna be a busy one. Buckle in and let's go see some patients. One of the things that makes a dermatological exam effective and unique, apart from that of many primary care physicians, is this tool that we use called a dermatoscope. This is a magnification tool, but it also has polarized or non-polarized light on it. This is like the stethoscope of a dermatologist. We don't listen to heart and lungs often, but we use this on almost every exam. With the magnification and the polarized light, we're trained to look for patterns in things that could be skin cancer and in benign conditions. We can even look at specific patterns in rashes like eczema and psoriasis to help us make a more accurate diagnosis before we even do a biopsy. So when we shine the polarized light on the skin, it doesn't have a reflection and it allows us to see really, really closely what's going on with that mole or that spot on the skin. And then if we put a gel on the skin and we used non-polarized light, it highlights different features. And all of these things are part of our training as dermatologists to make accurate diagnoses, even without biopsies, so that we can help save patients from unnecessary procedures and be more confident in the things that we're telling our patients. Starting out, we've seen rosacea on a number of patients already. This is an inflammatory condition of the skin that can mimic acne, but it's more common in adults and they're not quite the regular type of pimples that you would get with acne. There's a lot of inflammation, there's barrier compromise in the skin. And so when we treat rosacea, we focus on reducing skin inflammation and improving the barrier function of the skin. On a number of our patients, we have seen skin tags. These are little fleshy growths that often happen around the neck, sometimes under the arms, but they can happen anywhere on the body. We see these in people who have insulin resistance, pre-diabetes or diabetes. That extra insulin almost acts like a growth factor and tells parts of the skin to grow. We also see them in people just with a family history, and sometimes it happens just because of friction, but they're harmless on their own and can be easily removed for cosmetic reasons. Haven't seen any skin cancers yet, thankfully, but the next thing that I have seen is seborrheic dermatitis. This is the medical version of dandruff, where you get scaling and extra oil buildup, usually in the scalp, but it can also affect the face and the area under the beard, and that's where it was in this patient, is they were getting some scaliness and greasy scale underneath the beard. This is caused by an overgrowth of yeast on the skin called malassezia, and we can treat this quite easily, and once we reduce the levels of yeast to a normal level, that inflammation often goes away and we can see that the patient's skin gets a lot happier. As we've continued the exams, I've now found 4 skin cancers. 2 different patients had probably 2 different skin cancers. One of them were 2 squamous cell carcinomas on the arm, and the other one was a basal cell carcinoma on the cheek and a pretty large squamous cell carcinoma on an ear. So we are now 4 cancers in, and we've not even been here an hour, plus so many other diagnoses. So as we keep track, I'll keep coming back with what we're finding. The next diagnosis that I want to share with you guys is Prurigo nodularis. We had a patient who had Prurigo nodularis all over their arms, chest, legs, trunk, their ears. Terrible. This is an inflammatory condition of the skin where patients get itchy, they get lesions on the skin, they scratch them, they break open, and it is almost like a compulsion. You have to scratch because these lesions are painful and they itch so bad. And so these patients need specific treatment, and the FDA has now approved a couple of medications for Prurigo nodularis. And these are given by injection every couple weeks or every month, depending on the medication. One is called Dupixent or dupilumab, and one is called Nimluvio. And these have been revolutionary in treating Prurigo nodularis. And as I talked to this patient about the potential solution, they were in tears because they've been suffering this with years. They couldn't even get a biopsy done by their primary care physician. And to hear that there may be hope to help treat this condition and improve their skin as they prepare for their wedding was life-changing for them. So we'll be getting this patient in the clinic and getting them the treatment that they need quite quickly. The next diagnosis that I want to share with you is something called an angiofibroma. So basal cell carcinoma is really common on the nose, and that often appears as a non-healing spot. Sometimes it bleeds easily. While an angiofibroma is a little collection of collagen and blood vessels that are really common on the nose. They grow there commonly, and they can bleed easily, and in many ways may look like a basal cell carcinoma, and that's why people come in, because they're concerned about skin cancer. But thankfully, these little growths are completely benign and they don't turn into cancer, but they can be removed for cosmetic reasons, or if they're just bleeding all of the time, then we can remove them to make sure they're just not a problem in the life of the patient. On so many of our patients today, we've seen something called cherry angiomas. These are benign growths of the skin that are extra capillaries or blood vessels that form in the epidermis, or just in the dermis right below the epidermis. And they can grow sometimes to a pretty large size, but most of them stay pinpoint sized. They're bright red, and if your parents had these, you're likely to have them as well. They don't turn into cancer, and they can be removed cosmetically. In some cases, if they grow extra large, they can be quite irritating, and of course, they're more at risk of being traumatized and bleeding. And because there's so many blood vessels, they will bleed like crazy. So we often cauterize these in the clinic for cosmetic purposes to remove them, and it doesn't prevent new ones from coming back, but it does get rid of the ones that you have. Just want to pop on for a minute and let you guys know about the Mantl line of skincare. Mantl sunscreen is my favorite to use every day. It's a gel and it's totally clear. Mantl sunscreen is available on my website for $15 for one or $24 for two. If you want the sunscreen, the face cleanser, and the moisturizer, you can get the whole set for $30. Link is down in the video description. Now, I would be remiss if I talk about seborrheic keratoses, because we've seen them on almost every patient. Probably today I've seen 20 or more seborrheic keratoses. These are benign growths of the skin. They may look like moles. They can be big and scary, and a lot of people come in because they're worried that their seborrheic keratosis is a skin cancer. They can look like melanoma to the untrained eye. However, they are just made from skin cells that are not shedding off properly. And they're due to sun exposure and due to genetics. They can occur anywhere on the body. They're often kind of a velvety appearance or a warty appearance on top, but they're benign and they can be removed cosmetically. In some cases, they get quite itchy, and if you scratch at them, they can bleed, and we'll remove them in those circumstances when it's medically necessary. But we've seen so many seborrheic keratoses, and probably that's the main thing that people come in and they're worried about. Bumps on the legs of women, something called a dermatofibroma. Seen several of those today, and they are a scar-like growth of the skin. They often come from nicking yourself while shaving your legs. They can come from bug bites. They're more common in women than in men. And these kind of growths have what's called a dimple sign, where if you push on the sides of them from each side, they dimple and retract into the skin. And they are benign growths of the skin. In a very, very small percentage of people, these can actually be something called a dermatofibroma sarcoma protuberans. It's a mouthful, it's a big name, but that is a skin cancer that can be difficult to treat. I've seen only a handful of those throughout my 10-year career, but by and large, when we see these kind of growths, particularly on the legs of women, they are harmless, and we see them all the time. I saw a really big one today on a younger woman in her early 30s that probably came from nicking yourself while shaving. A couple more unique diagnoses that I haven't really talked about on the channel before. The first one is called Poikiloderma of Civatte. This is a lacy reticulated pigmentation that occurs usually on the sides of the neck, but it spares the area under the chin because it's due to sun damage over time. And really the only way to treat this and get it to go away is with laser treatments like IPL to help target the red and the brown discoloration that happens in a kind of a lacy fashion around the hair follicles. And sunscreen is the best thing to help to prevent this from occurring. In and of itself, it's not a harmful condition. The second thing that I want to bring up is scalp psoriasis. We just had a patient who has a lot of thickened scale, primarily on the back of the scalp. Psoriasis can affect any area of the body, but the scalp is a very common area, and in some patients, it only occurs on the scalp. And so for this patient, we recommended a couple of over-the-counter shampoos that could be helpful, but oftentimes it needs prescription medical treatment. And so that patient was given a list of all the dermatologists in the area so they could find somebody that's convenient to them to go have that treated. So the next diagnosis that I saw is not something that we commonly treat in my dermatology practice, but some dermatology providers do, and that is spider veins on the legs. These are like very small versions of varicose veins, and they can be treated with a procedure called sclerotherapy, which I've done reaction videos of sclerotherapy on my channel before because it is a very satisfying thing to watch. Typically, we're injecting hyperconcentrated saline or polydocanol, which is essentially a detergent that strips the lining of the veins and causes them to collapse and go away. It dilutes pretty quickly, so it's not a risk to deeper blood vessels, and it is a very satisfying procedure. But if you have spider veins or varicose veins, the number one preventative thing you can do to keep them from getting worse is to wear compression socks. I know compression socks are not fun to wear in the summertime because it's hot, they're hard to get on, I get all of that, but it remains the fact that it is the most effective thing to prevent the development or the worsening of varicose veins and spider veins. That wraps up another mobile clinic, and we saw about 40 patients in 3 hours time. Not all of these were full skin checks. I know that's a lot of patients per hour. Some of these are just 1 or 2 little spots they need checked, and those appointments can go pretty quickly. But in all, I don't even know how many different diagnoses we saw, and I'm sure that I skipped over some things that are just really common. So in that time, we definitely found some skin cancers, things people can go get follow-up and prevent them from becoming bigger problems. But a bulk of what we see is just very common things, and it is a skill to be able to provide reassurance to people, to let them know the things that they're experiencing are not going to be harmful to their health. So understanding normal is a big part of dermatology. If you guys want to continue to support the work that we do here in the mobile clinic, because we don't charge anybody to come and be seen in the mobile clinic, watching these videos and sharing them, interacting by leaving comments is a big help to us. And if you need skincare, purchase it through the links that we offer down in the video description, because that directly helps to support the mobile clinic. So I appreciate you guys being here and watching this video and learning a little bit about some of these unique things that we see in dermatology, and I'll see you on the next video.